do you make of the premise that there were central concerns that were reflected by both sides today?
I saw nothing but confusion on the part of our representatives about how healthcare works and what the federal government relationship is to the healthcare system. Public health is not healthcare. The physician is responsible for doing whatever is in the best interest of the patient in front of him or her, and is at their liberty to use any and all available resources, completely independent of what the federal government thinks, what the CDC thinks, what the FDA thinks. These are advisory only. And this idea that the CDC is an organization that is thus saith the Lord is a complete misrepresentation. They make recommendations. The insurance companies create a scam on those recommendations. They use it as a way to justify whether they cover something or not. But the recommendations are just that. The physician is at their liberty to do whatever they wish.
All right, but Jess, that's kind of the point, though, right? Is that's what the lawmakers were arguing, that you shouldn't be taking things out of the capabilities of doctors by saying, you know, none of these vaccines can be used for different kinds of people and make it hard for them to get them. You should leave that to the doctors and the patients. What was your read on the dynamic today?
Yeah, I mean, I think that was exactly Senator Warren's point when she was questioning him as well. You can say that, you know, that he's not taking away vaccines from anyone, but if the CDC is not recommending or is only recommending the COVID vaccine for 65 and up and people with pre-existing conditions, that leaves a lot of people who are no longer going to be covered by insurance. And if they're no longer covered by insurance, they're not going to have access to their vaccines when they go to their pharmacy. And so I think that that's kind of like it's just a loophole in terms of how they're explaining it. It's removing access from people when the CDC makes those recommendations.
For a small sliver. Medicare still covers it, Medi-Cal still covers it, and you can appeal to the insurance company, and if your physician is motivated, he or she can get that coverage. The vaccine is available. We're talking about the healthcare system. Nobody, and I mean nobody, is talking about taking options away from physicians. What is available to us is literally anything we wish to use on behalf of the patient, including any and all available vaccines.
But Drew, the question is, I get what you're saying about the agency dynamic here and the big brother dynamic. Okay, fine. But don't you think that the real battle that you're seeing on the right and the left is that, hey, you guys don't want people to believe anything but what you suggest in the moment. And when it comes to vaccines, we have something called science. There are things that are known that are not a matter of opinion, and those should stand. And on the extreme, Maha tends to put everything in the same bucket.
I don't know about extremes. All I know is that we didn't have the data to recommend the boosters, not the Alpha and Delta, the booster to 6-month-olds. We just don't have it. And also, why are we giving hepatitis B to 1-day-olds? There's just no data to support that. I don't know what we're doing. Once they explain that, once we have the data, well, now we're back in the scientific realm where we can trust the material being published. But as it is, the public has lost trust. You are right. The truth is meaningful, and science is an attempt to get at an approximation of the truth without any ideology, without any politics, without any encumbrances of pharmaceutical company or finances. And the problem is there's been a hand on the scale for quite some time, and things have been done that literally don't make sense, including recommending a vaccine for which they can get it if a family wants to get that vaccine, they should. But recommending it because based on available data, we don't have it. I boost all my 65-year-olds plus. Absolutely. The data is there.
You're talking just about the COVID vaccine. You're talking about the COVID vaccine, and that's one issue, but I'm just saying they all get thrown in the same bucket. You have the guy in Florida standing up and saying, no vaccines are going to be recommended, none.
Chris, he said no mandates. Do you have the bio?
He said they're not going to be required. Drew, hold on, Drew. Drew, I'm going to bounce this to Jessica. I know, Drew, and you're telling me that you think as a question of science, and I'm going to let Jessica answer it right now because she's more qualified, but if your position is, oh yeah, you don't need to make kids have to take certain vaccines to go to school, it'll be okay, just leave it to their doctors. I don't buy that at all, and our experience doesn't buy it. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.